Good morning, everyone. I'm Kimberly Chalia with PHCA. Thank you so much for joining us for today's webinar, After the Storm, Healing a Traumatized Industry, presented by Barbara Speedling, Quality of Life Specialist. A few quick updates to share before we get started today. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for 1.5 continuing education credits for all attendees. For those who provided an NAB number, credits will be uploaded shortly. We'll also be sharing certificates with those in attendance. As we begin today, all attendees will be in listen-only mode. Please feel free to submit your questions via the Q&A icon on your screen, and we'll make sure to answer as many of those questions as possible at the end of today's session. Now I'll turn over today's webinar to Barbara Speedling. Thank you.
Good morning, everyone, and thank you, Kimberly, for the introduction. And I'm so happy to meet you in Pennsylvania. This is my first opportunity to talk to all of you, and certainly I hope that you find this morning's conversation helpful. So we certainly have been traumatized over the past couple of years, and in my work for more than 30 years in long-term care as a primarily regulatory compliance and quality assurance consultant, I've seen a shift in our industry in the last couple of years because of the pandemic that I think will be long-standing, things that will affect us in the way that we approach our work, in the way that we define what is home-like and what is comfortable, and in the way that we anticipate the needs of the people going forward. So it's been a very tumultuous time. There have been so many things that we've had to adjust to, and so many things that have impacted the residents and the staff that we work with and care for. And coming back from this pandemic, overcoming some of the things that affected us is going to take an understanding, really, of how our culture has been impacted. And when I talk about culture in these conversations, I'm really referring to the way that we're socialized in an environment, the way that our community responds to each other. And in our particular community, the microcosm of a larger, population, is that we look at people who already have some deficits. Our residents are difficult, in their understanding of what's been happening to them and their tolerance of it. And so coming back is going to require us to really think differently about the things that we do and the people that we're going to now be caring for. So as we look at the populations that are coming, the generations that we will now be seeing in greater numbers, we're talking about ourselves to a great extent. We know that long-term care now cares for people much younger than we might have in previous generations. We also know that advances in medicine have people living longer, living more successfully with chronic illness. And so we have to really begin to understand that the demographics are going to shift. We're going to become more multicultural. And by that, we are embracing language and religion and, rituals and all of those things, foods and things that we have to really embrace now as our world becomes smaller. And I think a lot of populations really haven't adjusted yet to the shift in the demographics or even to the shift in the kinds of, disabilities that we will deal with. How many of us are really prepared to deal with people with long-standing addiction or chronic mental illness or intellectual disabilities that in previous generations would have seen them, perhaps at the end of their days long before their 50s or their 60s, and now we know that we see people with Down syndrome living successfully much longer than we thought they might in previous generations. So long-term care is going to become a community unto itself, especially for the baby boomer generation. And I'm not ashamed to tell you that, I'm at the tail end of that group and I am your next customer. And so you've got to consider that maybe you too should be looking in the mirror and asking yourself, well, what would I want if I have to avail myself of these services, if I am in need? And I've met a lot of colleagues along the way that didn't think they'd ever need the services that they were providing to other people. However, they've been surprised by events in their own life and having to now, have to seek services from an environment that they thought they would only be working in. So we have to really think about all of the services, the things that we're going to be providing to people, excuse me, and coupled with the problems we're having with staff recruitment and retention, and having the manpower to really serve our customers in the way that we would like to, all has to be factored into these kinds of things and looking at how we're going to proceed as we move forward. So a few, details about the populations, knowing certainly even 20 years ago, we knew that we were going to grow in numbers, significantly by the time we reached the 2020s and beyond. And we also know that people are living so much longer, and the baby boomer population represents a very large number of people coming at us all at once in retirement and their needs for health care. And certainly a lot of people feel as though we're not really prepared for that. We also know that we're going to be seeing certain nuances in the populations. We're going to see that so many people that are living longer, are going to need long-term care. We also know that women live longer than men, and we have to consider the shift in our culture where women are concerned. Again, being a child of the 50s, I grew up thinking that I was going to be Donna Reed and marry Father Knows Best. That's what I saw on television. That was our culture in the 1950s and early 1960s. But then I went to college in the 70s at a very liberal university, and I was told to burn my bra and get a job, like everything was going to change now. So the population of women that are coming to you are not going to be so easily entertained with coloring and bingo and the kinds of things that we might have offered to a very different generation of women. We also have to remember too that, we'll need long-term care longer perhaps than the generations before us because of medical technology, because of the advances and the things that we're going to be able to accomplish. The nursing home itself, we'll call it a rehab center, we'll call it a senior environment, whatever name we give it, it becomes the hub for this new population of senior, this new population of dependent person. ATM machines and having access to, better Wi-Fi and being able to visit 24/7 and have real privacy and real connection with my community. All of those things are things we're going to have to cultivate going forward. We have elements of it, levels of all of these things at this point, but we know too that things vary from environment to environment. Even the fact that, some environments have hydro pools and other swim programs and others don't. Some are more advanced and some are not. We're going to have to come to a place as an industry where we're very similar in our branding. That's what's going to make it possible for people to survive, I believe, the next generation. Gone are the days when you could go to the mom and pop and get one thing and have a very personalized and, home-like experience in another place down the street. The more we corporatize long-term care, the more we're going to have to think about that branding. Are you going to be a Hilton? Are you going to be a Marriott? Are you going to be the kind of place where no matter which of your properties I find myself in, I'm going to have everything I need and it's going to be delivered the way that I expect it to be delivered and the way that you promised. So many times our marketing now is really not truthful in a lot of ways. We often promise in our voicemail messages many things. We all care, but who cares more and who cares in a way that's more efficient? So if you're part of a corporate network, you need to start thinking about what branding really means to your solvency going forward. Who's going to need the care? Certainly, again, we have to think about the fact that chronic illness is going to be something that we deal with in greater numbers just because of what's happening all around us. Better diagnostic, technology. We look at diabetes earlier. We look at other kinds of things, earlier. Obesity is becoming something that we're really addressing in our society in a proactive kind of way. So a lot of things are going to help people to live longer, albeit with support and care that's ongoing for a period of time. We're also going to need to think about those people who have no support and how we're going to be able to provide equally and make sure that people have that equal access to the kinds of things they need if they have no one. And certainly, through my community connections here in Queens, New York, where I'm located, I've made a number of those connections over the course of the pandemic for seniors through one of the parishes here. No family. I'm actually the healthcare agent for one of those women who has no children and no spouse and so on. So we have to think about embracing those people. And maybe it's the time to start thinking about developing a bridge from community service into residential service. Are there things that you could be doing, or even if you are doing some of that now in the community service, the home care realm, maybe you could expand on that, make it an easier and more, efficient segue from my home into your environment, especially for those people that have no family support. So we also are going to see these kinds of chronic conditions, which tells me that what we do inside of our facilities, once these people are admitted, is going to be really important. We can't just give lip service through a cookie cutter care plan to healing these conditions. We can't just say, oh, the person has, high cholesterol, and we're going to, give them this kind of diet, and we're going to make sure they stay on their medication. What are you going to do to educate me, to teach me about better choices? If I'm diabetic, what are you going to do to help me to understand what technology can offer me today? The devices that can measure my, glucose on a regular basis, that can make me more efficient in managing my diabetes. Are we doing that? I'm not seeing social programming that looks at true education or self-help or self-awareness or those things that most adults really pursue in our culture today. We're big on reading about what to do, on researching on the internet about how to live better, to be healthier. But I don't see that being reflected in our communities inside of the long-term care environment. We also have to think about how boomers are looking at the cost. Many times you're going to find people have purchased long-term care insurance and other kinds of things. They've made arrangements, they've made their advance directives, they've prepared for things. So you're going to be dealing with a much more fully informed and educated demographic of people, people who aren't going to be easily, convinced to do things that they're not so sure of, or to put their money down before they're sure that they're going to get what they thought they deserved. So I think that you have to begin talking with your leadership team now about the fact that this next population, the population that's coming, that you may already be seeing in greater numbers, are going to be asking a lot more questions. They're going to be demanding more service. They're going to expect more personalization of what they do, and certainly more involvement in the things that are going on. And I think that we're not used to that. Something I've been hearing for quite some time now about short-term rehab populations that are not elderly, people. We hear that they have too many opinions, or they need too much, or, they think this is a hotel. Well, we are a service industry, and we are supposed to be helping people to, get to their personal best. And all of that involves giving a type of service and expecting, that people are going to want to be served. That's what we're promising them. So I think that if we look at what baby boomers feel and how they're going to affect the cost of healthcare and so on, we have to make sure that, to control the cost, to really, stay solvent, and to really stay ahead of the kinds of things that are happening, we do need to look at staffing. And we are going to talk in a few minutes about that issue of recruitment and retention, and some of the things that we could perhaps do to refocus our efforts, or to look differently at what attracts people to commit to an environment or to a position. We can also talk about, looking at senior care facilities that are perhaps more specific and more affordable. Not everyone needs the degree of skilled care that a nursing home might provide, and not everyone can survive in the typical assisted living with what's provided there. So maybe again, we have to reinvent ourselves into another hybrid type of population where we can service a different need. We also need to use technology more efficiently. There are lots of things that we could do with technology that would minimize some of the human resource kinds of, responsibilities that we have to now be beholden to. And I think just in general, being smarter about time management, about staff oversight. Too many times we don't have good oversight, so people make mistakes, or perhaps they should have known something, or they should have done something and they didn't. I see that's often the reason that we get deficiencies. When I write a plan of correction, it's most oftentimes going to be a human error that caused us to have that interruption to the work that we do. And certainly plans of correction take away valuable time from the things that we need to do. So in the graying of disability, the time when people are living longer, even with chronic healthcare demands, we need to make sure that we can accommodate these people. And that's going to be harder and harder to do as the workforce that's out there to accommodate is shrinking. We're already being told that, having your own doctor, someone you can actually talk to and have a relationship with, is going to be a rare thing as we move forward. Already we're seeing the PA or the physician's assistant or the nurse practitioner substitute for your physician a lot of times until you say, well, I'd like to speak to my doctor. And then, of course, your doctor will step in. So as we look at this, we have to again consider how we can make available to the people we care for those people they feel they need to talk to, in the most emergent sort of way, like who are the people who are going to be most effective in their minds in helping them. Many times too, people don't even understand the roles of the various caregivers. So like for instance, in one place, to make things more efficient, they put a placard at the bedside. And on one side, it tells you what to call your nurse for. And on the other side, it tells you what to call your nursing assistant for. And that solved a lot of problems and a lot of communication issues that you might think are minimal, but really interrupt the day a lot of times and cause people to react like, in a way that's inappropriate sometimes. Like, didn't I tell you? That's not what I do. I've heard that in frustration. So make it easier for people to know what they should be doing. The people of today are going to expect also to be involved. We need to be more aggressive about getting people to care plan discussions, maybe taking care plan discussions to them, maybe using technology to do Zoom sessions to get families involved in ways that we couldn't before. Certainly, we've honed those skills in technology over the course of the pandemic. It should be something that we welcome as an efficient way to include people. We also are going to really expect that people are going to want to be more independent. We're not going to see group activity kinds of desires like we might have before. People a lot of times want to be left alone with their technology, their smartphone, their computer. So they're not going to be as dependent on us for their socialness, but they are going to be focused on us for their health care and for their wellness. And I think we have to shift our focus as caregivers away from that very tight routine of getting everything done to stepping back and looking at these individuals and really embracing what is person-centered, person-directed in the kinds of care that we offer to people. And you and I both know that that's what we would want as individuals. That's what we are accustomed to, is a more personal way of dealing with people. We want to talk to a real person. How many times do you hear somebody say that when they are confronted with a voicemail system when they're trying to get information? Can't I just get a real person? So that's what we want. We want to be involved. And I think that you're also dealing with a better educated population of people. Certainly our advances in higher education over the last few generations have produced a much more well-informed, well-read population of people. They want to know, and they're going to ask questions, and they want a good response. And they don't want us to get an attitude when they ask those questions. So right now, families rely at home on unpaid caregivers. That's going to shift. We're going to see more demand for home care over time. People want to age in place. Again, introducing that idea of creating that more, consistent, more efficient segue from what goes on at home to when I might need your services. Looking at adult day services, a lot of those places went under during COVID, have closed, or have been slow to reopen. So people are looking to find those services again. Maybe that becomes the segue for you, from home to adult daycare to residential care when I need it. If people get to know you before they need you, they're going to trust you in a way that they can't right now. If you consider what press about long-term care has always been, it's never been positive. People have never thought, oh goodness, that's where I want to spend my days. Not even assisted living. Oftentimes, the general public doesn't even make the distinction between nursing home and assisted living, and aging in place has blurred that role or that line sometimes to a great extent. So we have to consider now that the COVID pandemic kind of marketing that we saw of long-term care has only made things worse. People see us as the villain here. We let people die. We didn't have what we needed. We weren't educated. We didn't do the right thing. So coming back from that is going to take some time, and for the public to really trust us again, to really feel as though that they can come into our environments and be safe and be cared for and not be worse off than before they started, we have to look at marketing in a different way. So it's enough to say that if we capture people's trust and their interest before they really need us, then at the time that they need us, we're going to be the first place that they turn to. So 80% of home care is by unpaid workers, about half time a week, 20 hours out of a typical work week. And we know that those caregivers are having a lot of responsibilities that they're not really trained for. And we could be opening a door to more elder abuse, neglect, because people just aren't really ready to care for a family member in an intimate way, the way that a paid caregiver would. So we're going to have to think about all of that shifting, and that, so many of the people that are going to need the care going forward are going to need it for a long time. I have many friends now here in the community that are in their late 80s, early 90s, and no sign of, stopping anytime soon. So we have to think about longevity. And again, that adds to the financial burdens that people will be experiencing. So, more solutions, like here in New York State, and I don't know in Pennsylvania if you have a similar program, but here our Medicaid program has a system where a family caregiver or a friend can be paid to be your caregiver. And so that's kind of bridged that gap a little bit, but we're still going to need more solutions for these kinds of things. So participant directed services is what we're really needing to get to. And that's more than, person centered. This is really about giving people autonomy, about saying you don't have to eat breakfast at 7 a.m. We understand that that's not how you've lived. And so here, to the extent possible, we'll make accommodation. And being willing to do that has got to be part of your brand. What do you want? Do you want to be able to get up when you want to? Do you want to have the support that you need? Do you want to be empowered to direct the things that are going to happen in your day? These are all important things to be talking about with your leadership team. We can't go forward with business as usual, the morning report, and then we do this, and then we stop. You have to think about that long day for the people that you're caring for. It's not enough to get up and be clean, dry, and well fed. Part of your branding has to be achieving what the law really expects of us in terms of quality of life, that we're really going to create an environment in which people can thrive, where they can feel a sense of self-worth and well-being and self-esteem. Those are all important things that we have to really work toward. So the responsibility for the cost, of course, people don't want to have to pay for their care. And we've gotten into a bad place with, people being able to shift funding a certain amount of time before they're going to need care. It's become something that has really plagued our public system, because there are monies that could support people's independent care, but they are, moving those monies and doing other things with them. So people are looking to a public system, and as much as Medicare is working for many and the Advantage programs and so on, we still know that this is going to be a work in progress. And how we lobby for the things that we need as an organization, as an industry, is going to be important to how all of this payment and finance stuff, goes forward. So again, most people feel that we are not prepared, that most people are not prepared for the responsibilities and the costs of long-term care. So maybe another service to your community, a way of looking and anticipating the needs of a new demographic of customer. You want to think about education, maybe talking ahead of time, offering community education at no cost, inviting people to come, or even virtually having education sessions to school people, if you will, on what it really takes to have long-term care involvement and how to navigate those things for your family or for yourselves. So all of your customers have to be people that we consider going forward. And most importantly, your staff are the first line of customers. Yes, they come even before your residents. If your staff are not happy and satisfied, no one will be. And you know that as well as I do. Your residents, their families, and the extended families and friends of your staff as well. People like myself, consultants coming in and getting a first impression of who you are. Other partners, your vendors, and certainly other consumers that haven't met you yet. They're only going to learn about you through word of mouth, what they read in the newspaper, or what they experience in the short term, or when they perhaps pursue your organization for some kind of information. So we've got to consider everybody we come in contact with a potential customer. We also know that those customers we need so desperately, the staff that we are missing, are in short supply everywhere. It's not just in your state, it's not just in one town, it's every place that people are struggling for, a workforce that's really going to serve us well. We know that 94% of our nursing homes, and many are closing behind the staffing shortages or have a moratorium on new admissions because they don't have the manpower to service the people. So in the last round of conversation that I heard from Mark Parkinson just recently at a conference, he was talking about the fact that we've lost 15% of nursing home staff nationwide. And that's not even really considering those numbers that are, piling up every day. So we have to think about the burnout, that people are stressed, that they are, experiencing what we call compassion fatigue. And that if we're really going to re-inspire people to come back into the workforce, we have to look at what was going on even before the pandemic. So in this very extensive report over 10 years from Gallup, we found that before we even got to, COVID-19, only a third of the workforce was really involved in their work. And more than half of the people just showed up. So this isn't something we're just combating now. This is something that's been growing and has been exacerbated by the pandemic. So we have to think about the kinds of things that are important to people. And, we joke about millennials and how they're so different and they want, things that are so odd or whatever. But really, this study finds that they want what we all want, that our work is meaningful, that there's a purpose to it, that we use our skills, that we can develop and grow, and that it does suit our life. And even more now that we've learned that we don't always have to gather in the same place to work or to learn, it has to fit our lifestyle. We've learned about a lot of voids in our society. We don't have good childcare. We don't have good, remote systems set up for schools when there's emergencies. So we've learned a lot, but we've also learned that we can work through technology more efficiently. So these are all things that we have to consider now as we look to recruit new people. Some of the things we need to overcome are very fragmented systems of orientation. I meet staff all the time on mock surveys where they haven't had any real orientation, or the staff that haven't had a complete orientation. I asked one young lady, what they announce if they think that a resident potentially has eloped from the facility, and she looked at me and she said, oh, I don't know, I think you call 311. Well, here in New York City, 311 is the mayor's information line. She didn't even know the right answer. And you and I both know in a real survey, that could be a potential immediate jeopardy. It's a very important question. So policies and procedures, rules, the way we do things, making sure we have copious and current and appropriate education for people, making sure that people understand what their job responsibilities are and that there is a sense of order and oversight. We have to also make sure that our managers know how to manage people. One of the biggest Achilles heel we have in long-term care is that many managers have never really been trained to manage other people. And there is a science and a psychology to that. So if we really want more teamwork, more mentoring, more working together more effectively, we have to look at how we manage and how we supervise and how we model the things that we want people to do. We also have to look at friendship, the basic relationships that we have with the people we work with and for, and the people we're caring for. We need to make sure that we have positive relationships because those will feed a more positive teamwork, a more positive atmosphere in your community. We also know that when there is good engagement and good relationships, that's what makes teams excel. That's when they want to get together, when they want to support each other. So if we possess this sense of commitment and affiliation to our organization, to our team, we're going to really, probably accomplish our goals and more. It's going to be very positive for us. So I think that we have to move forward and really consider now, if we are dysfunctional, what is it like to be part of your organization? Do you have to work with people you don't like? If we don't make a good first impression, what are we doing about that? Are we finding ways to improve relationships, getting people to know each other? In the leadership realm, are we going out? Are we taking a retreat opportunity to get away from the office, to make some memories, to learn each other outside of that work personality, to learn what's valuable to you, see how you shape your own thinking about the world and how you fit in? Those are all things that are going to build relationships, even residents. Maybe helping them to find other residents who share their occupational history, small things that we could do to encourage better socialness, better accommodation, better association or empathy with each other. So much that we could do. We also know that if we're really going to build these relationships, our managers have to do more to bring people together. Look for opportunities. You know, we used to have baseball teams and bowling leagues and family picnics and things like that. We've gotten so far away from those things over the last 10 years. We can't even blame the pandemic for that. People started cutting corners in 2008 when finance was troublesome again. So we have to encourage people to get to know each other, get to know each other a little bit better. Not that you have to intrude on people's lives, but we have to know what's valuable, what brings us together, where we have a chemistry or where our thinking is the same about what we want to deliver. So cultural intelligence is so important. We need to understand the demographic, the kinds of people, that we're working with and for, and what that social order is like. We need to look at managers and make sure that we get them into that kind of training and oversight that they need. We have to help everybody understand behavioral health, trauma-informed care. What does that really mean? And what does it mean to the morale and the motivation in the environment to help people move past just doing the mundane everyday thing? What's going to make us excel to give our customers a better experience? How are we going to answer the question when it's asked of us, what is better about the quality of life in your place than the place down the street? How are you going to respond to that? Can you respond to that? So let's talk about the trauma of the pandemic. Trauma is what happens to us, and it's a loss of freedom, a loss of trust, a loss of health and security, and so many things that you would find at the very basic, level of Maslow's hierarchy of need. And once we lose that trust, we lose a job, we lose a home, a person we love, a role in life, something or everything. If we move into a long-term care environment, we lose everything. So we grieve over that. And what is grief? Grief is a lot of things. Grief is denying that I need your help. Grief is denying that there's an epidemic. Grief is anger, sarcasm, lack of patience, telling you to get out of my room and shut up and leave me alone. That's all grief, depression. And finally getting to a place where maybe you don't care at all. And that's dangerous, to get to a place where you say, shit, whatever, whatever, who cares? So we've got to really embrace what grief is going forward for your staff and for your residents. How are we going to combat this very deep sense of grief? And more so, for the people working with you, how are we going to look at this phenomenon of moral injury, something that we experience now as, people working on the front lines, people being involved, with people's life and death situations, and having to account for the things that we're doing or what the public thinks we're not doing. There's just so much of all of that that we have to really think about, things that we have to consider that maybe we've never considered before. Moral injury can occur because maybe we didn't have the things that we needed to do the work. It can occur because maybe we saw things and we questioned our own faith and we said, oh, how could a gracious and loving, entity, a God that I know, make this, how could they let this happen? So people have faced a lot of issues emotionally, physically, behaviorally, so many things as, having faced all of this, and may carry, a lot of these emotions with them. Are we disgusted? Do we not care? Are we angry about things? Are we ready to remove ourselves from this environment and say, I'm going to go open a flower shop somewhere? There's so much that has caused this mass exodus from our industry, and mostly from those people who've been on the job a long time. That experiential group of people who can teach us and help us work through all of these things because they've done it before. They've moved on. So we also have this challenge now of a brand new leadership, a workforce of much younger, much less experienced people. And so we have a learning curve perhaps also to deal with that we've never dealt with before. And maybe for the first time in our industry, we have a phenomenon of longevity in the workers that are doing the day-to-day hands-on, and a very young leadership. And so there again, you have an imbalance that may cause problems in the way that they communicate, and whether or not there's a respect from one level to the other, and whether it's maintained and there's a balance there. So we've got to really look at, creating an environment that's healthy, going forward, protecting mental health across the board, looking at the work-related kinds of things that impact people, like short staff and not having resources and not having good communication or organization. The left hand doesn't know what the right hand is doing, not having good leadership. All of those things are going to impact the way people feel about their work. The positive aspects of work need to be promoted, and the things that people bring as strengths to the job need to be valued and really looked at. And you need to address mental health no matter where it starts. So many times we know things about people, like a friend of mine, a nurse consultant in another state, has an organization with several facilities. And in one of her properties, an estranged spouse, angry, came looking for his, spouse one day at work, and he killed 8 people before he found her. So these are the kinds of things that we can't overlook. There was even a case a number of years ago here in New York City where a gentleman who was angry with his sister and his mother was the resident of the nursing home. He came in at lunchtime and he killed his sister and his mother in the dining room in front of everyone. So you can't overlook domestic violence. You can't overlook spousal kinds of issues. You can't overlook disgruntled employees. And in today's world, everybody is angry. So these mental health issues that are affecting our whole world, our nation, everywhere we look, we see violence. You can't overlook that inside your environment. Something else we're seeing is a great divide, again, in terms of racial and ethnic kinds of problems. So we've got to welcome people of every sort of, culture, every sort of diverse, background. We just don't have space in our world, in our industry, for being, separatist. So we've got to think about the populations. We're going to be seeing new people. Our populations are changing all the time. Our world is becoming smaller all the time. These are things we have to talk about. So one of the first things you have to do is take a look at policies and procedures, making sure that we're safeguarding physical health, making sure people have the things they need to do the job the right way, that we have the support available to them, oversight to help them, to make sure that we make the right decisions and that we do the right kinds of things, that our work life and our home life and so on, that there's a balance, that we really see that there's an opportunity for development is too. Nobody just wants to go through life marking time, I don't think. Are there ways to really recognize people, those who really want to contribute, and reward them for that interest? Sometimes we think there's no place to go from that job that I'm doing, but could we do better at finding a place, to take you up from where you are? I find sometimes we underestimate the value of education, the value of taking someone and cultivating their knowledge, helping them to not so much understand they need to learn, but making them want to learn. That's how I usually approach education. I want to inspire you. So you see, God, you say to me, gosh, how did you do that? And then I can teach you. So who are your customers, and do you know what they really want from you? So I took some time on your behalf and I interviewed a number of different stakeholders now in my community, different walks of life, different kinds of things that they've done in the community of long-term care and in their own residential communities, and the things that they might want to talk to us about. So one of the first people that I spoke to was a longtime nurse consultant colleague of mine. And what she talked about was the fact that people are going to want more from long-term care, that it's going to take us a long time to come back from the things that we've experienced now, and that people are going to want to know us in a more personal way. They're going to want that one-on-one relationship. And so we have to start thinking now about our public relations. Excuse me. I think that we also have to consider that attracting new nurses to our population is going to be important in how we put ourselves out there, the kind of impressions that we make on people, and the way that we engage people in the importance, the value of the job that we're doing in nursing, and really bringing people into it now. We find a lot of young nurses coming in behind the pandemic have only learned virtually. They're not prepared for the hands-on work that they're going to do with real people. So we have to think about, making that education more realistic for them, helping them perhaps before we go through training and investing in them to understand what the job really entails. I then asked a retired nun who serves as a pastoral care minister for other retired nuns living in long-term care. And she said for the future, at 85 years old, she said she hopes that we will, continue to look at the person and not just what's wrong with them. And that's been based on her observations in long-term care for, the time that she's been providing pastoral services. She said they often know a lot about what's wrong with people, but they don't really know the person. And I think we've heard that for a long time, especially as we've lived with the epidemic of dementia. I asked this couple, the gentleman is in his early 80s, his wife is 12 years his junior. He is a retired veteran, so, he has VA benefits. But I asked them how they think they would fare if in fact they couldn't, rely on the services or pay for the services like they do now. Would they be satisfied with Medicare and Medicaid? And what they said to me was that they really don't think that they could abide just by the government provided services. The one gentleman, said, the gentleman said that he's a veteran, so he wouldn't really have to worry about that. But his wife said that's why she's investing in long-term care insurance and why she's paying attention, because she's afraid that, if she had to go on the Medicare system or Medicaid, that it just wouldn't serve her needs and she wouldn't be as satisfied. This gentleman is a good friend of mine, a 92-year-old retired nuclear medicine physician with no dementia and a body that doesn't work. And he said what he loved most about practicing medicine was the relationship he had with his patients, that he could spend time talking to them and getting to know them. And he said now, being a patient himself, he sees that he can't have that anymore. He can't have a relationship with his physician. They don't have time to talk with him, time to know him. And he sometimes is insulted by the fact that they overlook that he is a physician himself, one who still holds his medical license. So we have to consider that there are a lot of retired professionals out there with no dementia who still want to retain their status in life. And do we know that? This woman was somebody that I thought had a dual, reason for thinking about the future. She is 81, but she also is the primary caregiver for her 60-year-old daughter, who is in an adult group home. She suffers an intellectual disability. And what she told me is, for herself, she's not so worried because she thinks at 81, she doesn't have a lot of years left to worry about her health care, and she's satisfied with what's being provided for her now. But she worries about the health of her daughter going forward. Will we recognize that people with intellectual disabilities need advocates to speak for them, to understand how they understand the world and the kinds of things that they're going to need going forward to really be able to live a life independent of their parent, their primary caregiver? And she worries about leaving her daughter, and she thinks that's one of the reasons why she has the stamina and longevity that she does. That's what her faith teaches her, that she, has a reason to be here to care for her daughter. So if you're really going to move toward transforming your workplace and thinking about how you're going to accommodate these new customers and their needs, you need to really start talking with your staff now about the things that you want to accomplish. What is, the vision? How is your executive group going to come together and transform your environment from an old-fashioned way of controlling everything to one that really speaks to developing and moving to an ongoing collaborative relationship with the people living and working in your environment? A lot of times I think that we tread too lightly and we say, well, we're going to try this, and we try one little thing at a time, but maybe you need to sit down with a strategic plan. There are so many aspects of what you need to look at going forward, not just how you're going to appeal to the public in terms of residents, but how you're going to get the staff, how you're going to keep them. How can you answer the question, what makes a person want to stay in an environment? When I ask people that, it usually, is about how they feel when they're there. So maybe it's time to ask the people living and working in your environment how they feel about doing that. I've been asking some of my local clients those same questions. I've been solicited to work with them to look at why they're having a revolving door. New staff come and they don't stay, or people with longevity are leaving. And one of the things I did, and you may want to try this for yourself, is I interviewed them as a group, the leadership team, and I asked them how they got along, and they told me they got along beautifully, that there was a stellar relationship. They work hard, they all care about the same things, they get the work done, yada, yada. Okay. Then I said, well, I'd like to interview you all individually. Will that work for you? And they said, sure. And boy, what a different conversation I got. They really purged themselves of all the things that stood in their way. You know, they described the other people as being immature and selfish and not willing to work together and territorial and defensive and not open to change and so many things that they wouldn't say in front of each other. So maybe you need an intermediary to get down to what's really going on in your environment and what we really need to heal. In one place that I'm working with, we learned that the administrator himself is too weak. He does the work himself instead of making people responsible for doing the work. So they just stand back and let him do it. You know, there's a difference between mentoring and coaching someone and actually doing the work for them. Once you begin to do the work for them, maybe you lose some of that respect. So what are the things that are challenging you right now about moving forward and transforming your environment into the next incarnation of what you're going to be? Moving from a satisfaction kind of environment to one where we want to learn, where people, you know, we want to know how much they like the things that are going on, but we also want to know how much they feel that we invest in them. So, you know, I've given you this link down here to this study, and I think it's, you know, really important, even though it's a couple of years old. I think it has a lot of really good information. So if you want to improve your customer experience, start first by education. You know, look at really training your staff into being a service industry and what that means in a world where we're beholden to trauma-informed care, to making sure that we understand that by the time we meet people, they've been through a lot of things. And we have to cultivate an environment of healing and recovery that really is driven by the things that people want from us, the things that they expect from us. We need to set progressive kinds of goals, not think that we're going to get from 0 to 100 in one fell swoop. We need to look at first impressions. When people come to us, when they call us, when they meet us online, are we welcoming? Are we positive? You know, can we speak to our quality of life, the kinds of impressions that we want to make to people? Are we clear about who's doing what we expect of people? Is our communication good? Are we efficient? And do we stay on top of things? Or am I going to pull a policy manual off your shelf that's got dust on it? Sometimes I find that we don't stay on top of detail, and that's what causes us the biggest chaos, is that sometimes we have 5 and 6 policies that nobody looked at the previous one before they made another one or revised it or whatever. So start by looking at the core of the things that you do. Teach your managers to be coaches. Help them to communicate better, to have better people skills. When we have to, you know, discipline someone, we don't do it in public. We don't do it in front of people. And we don't go again from 0 to 100 in expectations of improvement. We give people small things, and we're out there every day. And we're saying to them, what did you accomplish this week? What do you hope to accomplish next week? And do you hope, you know, to have more than that? What are your thoughts about your job? And how can I help you? Do you give people an opportunity to ask for help? Or is it like some of the groups I've interviewed where they say, well, I don't ask for help because when I do, they make me feel stupid. If we're not valuing people and making them feel comfortable in soliciting the kind of support that they need, we're always going to have a deficit there. We're always going to run the risk of not having appropriate service. So take a look at how we, you know, manage, how we demonstrate the kinds of things. Many times when I'm in the environment, I don't have to make it a point to say, okay, I'm going to educate you now. I simply demonstrate a better and more efficient way of doing something, a way of getting in and talking to someone, something that works. There is a way to talk people down from even the most stressful situation. And we can learn all of those things, but it also has to be modeled for us. And that's what we should know as leaders, as coaches, as managers. So role in relationship, getting people comfortable with what's expected, making sure they know, getting out there, seeing that they're doing things, that there's no barriers to them getting their work accomplished, checking in on a regular basis, not waiting, excuse me, not waiting a month or a quarter before we check in or a whole year before we look at, you know, your performance and so on. We want to be always looking at these things, keeping people on their toes. So many times in a mock survey situation, we'll find out that maybe we never really did a disaster drill. So that's why we don't know what to do when things happen. So we've got to look at our progress. we've got to monitor where we're going and how we're going to get there. And I think once you start looking at that and using your quality assurance the way you should, you're really going to be able to improve. Forgive me. I'm sorry about that. So lastly, we need to really look at branding. Excuse me, just one second.
I'll take over for a second, Barbara. Go ahead and take a moment, as much time as you need. I want to remind everyone that the Q&A icon is available. So if you want to, as Barbara's, just taking a little break here, if you wanted to submit any questions using that icon, that'd be fantastic. Thanks. I think Barbara's ready.
Okay, I'm sorry for coughing up a lung here, folks. That usually tends to happen to me toward the end of my session. I apologize for that. So what you really want to do is look at a way of engaging people. More importantly, really getting to a point where you can describe what that brand is that you are striving for. Working toward better management, looking at what motivates people to get involved, and certainly wanting to be more clear and more concise in the way that you communicate with people and get your point across to everyone. Oh my goodness, that's terrible. So we do know that the business is about people. It's about the relationships. And I thought that it was nice of Kathy Ireland to put this in such a great, format for us. But it is about getting to know your workforce, getting to know your strengths, seeing where your deficits are, and planning ahead so that you anticipate what the next generation is going to want from you and you don't wait until you're there. So I think that you can, take this information, I hope, move forward through your quality assurance process and really, make this an opportunity to begin a fresh, new perspective on who you're going to be in the future. I think that there's a lot of opportunity here to grow, to diversify, to specialize perhaps, and to really do some local research into what your demographics may look like in your particular community. Having more information will give you a chance to begin to cultivate other services, to make liaisons with other kinds of service organizations if that's what you need to do, and to make sure that, no matter who comes to you for care and what their needs are, that your staff is going to have that cultural intelligence, that emotional intelligence that we need to be able to successfully care for and work with anybody that's in our community. And that's really what we should strive for. So I thank you so much for your time and your attention to this conversation. I apologize again for my little blip there of my coughing. And I would ask you if you have any questions, now is the time, for you to put those in the chat box if there's anything you'd like to talk about. I'd also like to offer you, further resources if you are interested, if there are questions that you might have later, or there's other things that you would like to see that I accessed in preparing for this conversation. I'm always happy to share those things with you. Contact me by email or by phone. And if you go to my website, there is a number of articles and other resources there that might help you in cultivating, the environment of tomorrow for that next generation of customer that you're going to serve. So I'm going to send this back now to Kimberly and see if there's anything else that we would like to address before we close this session. And to remind you that we'll be back next week again with a second portion of this, which goes deeper into looking closer at managing the business of people. So Kimberly?
Thanks, Barbara. Yep, just to remind everyone once again, if you do have any questions that you'd like to submit before we close today's session, feel free to do so now. Thanks so much, Barbara, for sharing this important information today. I'm looking forward to part 2 next Tuesday at 11 a.m. Yeah, I'm not seeing any questions coming through. So if anyone does have any questions after we close today's sessions, please let Barbara or I know. We look forward to having everyone again next week. Thanks, everyone.
Thank you. Take care now.